can be difficult to talk about death or dying, what our end-of-life care looks like and how we might be cared for as we age or become seriously ill. You might think it isn't necessary because you're too healthy or too young. Or you might not understand what's involved in palliative and end-of-life care and what steps you need to take to make a future plan. You might not know how to start the conversation or want to upset your loved ones by talking about it. But as hard as it might be to start the conversation, it's an important one to have. Talking about your wishes early empowers you to make plans that are in line with the things that you value most. Palliative care is commonly mistaken as being the medical care you receive only when death is imminent, but it's much more than that. Palliative care is about improving the quality of life when facing a life-limiting illness. It focuses on your care needs and aims to prevent and relieve suffering by treating not only the physical, but also the emotional, social, and spiritual symptoms for you and your family. End-of-life care is about the palliative care services that you and your family receive when you're facing the end of your life. It often involves many health professionals bringing together a range of skills to support your illness and your family. Wherever possible, end-of-life care is provided where you and your family want, at home, in hospital, in a hospice, or a residential aged care facility. Palliative care is available to anyone with a life-limiting illness and can be accessed through referral from your GP, medical specialist, or other health provider. So how do you talk about this important issue? Some of us will find discussing palliative care easier than others. There are many factors at play: your mindset, values, beliefs, culture, health, family relationships, and so on. It's important to remember there's no right or wrong way to talk to your loved ones, and conversations like this are likely to happen over time. The Department of Health website has useful resources that may help. The next important step after having conversations with your family and healthcare professionals is to create a plan that documents your wishes. This is known as an advanced care plan, or an advanced care directive in some states, which is the process of planning your medical care in advance, regardless of your age or health. It's important to start talking early about what matters to you, to maintain as much control as possible over your end-of-life care choices. Have the conversation with your loved ones the way it works best for you. Visit www.health.gov.au/palliative care.